I shared a little bit about my experience coming here with mechanical lifts and lack thereof. Another issue that I faced, which was really surprising to me, I moved here from London, Ontario, which is a much smaller city. And here in Calgary, when I moved, there was maybe 1.2, 1.3 million people. But there was no private or public place for a lot of accessible radiology. So if you needed an ultrasound and you needed a mechanical lift, there was nowhere in Calgary to get that. If you needed bone density testing in the public or private system and needed a mechanical lift, or even for someone to help you transfer for bone density, there was no place to do that. And there was a lot of times where I tried to have conversations with radiologists or head of diagnostic imaging for different places, and it was like banging my head against the wall, trying to explain why this is a basic human rights issue and wouldn't just help someone, for example, with a spinal cord injury, but could help so many more people. And then one day in the news, it came out that someone finally challenged this in law in Alberta, and that was Dr. Chipeur. So I'm sure you'll share a bit more about that. But that really just made a difference within Alberta and across Canada for people with disabilities. So Dr. Chipeur holds the Azrieli Accelerator Professorship in Law and Disability Policy at our University of Calgary's Faculty of Law in the School of Public Policy. She has a JD from the University of Toronto, Faculty of Law, and is a member of the Law Society of Ontario. She completed her LLM and DCL at McGill University's Faculty of Law, and in 2014, Stephanie was injured in a car accident and became a wheelchair user. As a member of the disability community, she brings lived experience to her research on disability law and policy. Thanks again for coming.
Thank you. Okay. Oh, I'll let you talk. Do you have that question? Do you have that question? I'm going to put a question up for you to do on Slido because I want to know more about who's here in person and online. I saw there was a question earlier about who you were, and I didn't get all the categories that one did, but just if you don't mind, fill this out and tell me who you are, just so I can understand who I'm talking to. And if anyone has extra napkins, I spilled some of my coffee. So if you don't mind giving me your napkins, my coffee's there, you can just drop them off if anyone has. So when, I don't know how this works, but whenever I guess enough responses come in, will it start to populate this next slide? Oh yeah, I see it here on this computer. It just hasn't come up on the screen. How does that work?
Great question. Let's see.
Part of the reason I'm asking is I want to know, like, are you someone that might get a complaint brought against them, or are you someone who might bring a complaint and like maybe you won't even get involved in a human rights complaint because you see yourself as like a very, you're in the lab, you're doing research, and you might think it doesn't apply to you. So when I saw the way people answered this question earlier, it said that the majority of people were actually practitioners. Now I'm getting more academics and less practitioners. So it's changed since the morning. When did you guys do that original question?
We probably did it just at around 10, but
okay,
there was only like 12 people that responded. So
okay, so this is more
scientific for the researchers and academics here.
Okay, so the majority are researchers, so that's fine. I can give a little bit. I'll skew a little bit more that way. I think enough have come in. I'm kind of getting a sense, but definitely some are practicing, and so that's. I'll also mention things I would say to people who are medical professionals who are in practice. As for changing the slides, can you do it? Do you need to stand up here? Is that okay? Okay, cool. I'll let you know. So the reason that I'm talking today about a human rights complaint is because I brought one myself, and so I have a background as a lawyer, and so as a person with a disability who became a lawyer first, I've seen a lot of disability through a legal lens and basically seen how my privileges and my place in society drastically changed. I still have a lot of privileges, like a white woman, obviously, and I feel like the wheelchair in some ways can be a privilege too, because my disability is obvious to people. And if you say you're quadriplegic, that's just like, oh yeah, you're definitely disabled. You don't need to prove it to me. So there's some ways I'm still privileged, but I had a big loss of privilege when it came to going places, especially in the city I was living in when I was studying for my PhD. I was in Montreal, and it was really, really inaccessible. And so I really focused a lot on the built environment. But today, what I'm going to talk to you about certainly is about access to diagnostics and is more built environment skewed. The human rights complaint process is something that you can use for discrimination in a lot of different types of ways, not just the built environment. So don't feel limited to cases just involving someone who's a wheelchair user, just because that was my initial experience. So, okay, I think we can go to the next slide. Okay, great, this is good. So, as I said, I was looking at things through a legal lens, like what did I lose since I became a wheelchair user? And so I first was really looking at building code, but it's really hard to make a real difference if you just complain about one instance of inaccessibility at like a restaurant, for example. So I was always looking for a case that would have a little bit more of a systemic reach. And finally, something landed in my lap that was super easy case to make. And I also knew that the human rights complaint process is very low cost and user friendly. So for me, it was like, oh, this is a great opportunity to learn what it's like to be a disabled person fighting for more accessibility in the world. So that's why I chose this. I could have done, I guess, lots of other types of lawsuits, but this is the one I chose. So anyways, what happened was I was not allowed to make an appointment with EFW. I'm sure you guys all know EFW. It's one of the major diagnostic companies in Calgary and Alberta. I think Alberta, but definitely Calgary. And so they wouldn't give me an appointment because I refused to bring a person to lift me and transfer me onto the exam table for the ultrasound. And so I knew I had them because the denial occurred on a phone call with the appointments booker, and those are recorded, A, by EFW, and then B, the person said, we can't help you because of your injury. She was using the word injury, but of course we can also use the word disability, right? So I was like, perfect, okay, great, you said the magic words. And so I wanted to fight for the fact that ultrasound clinics and any other diagnostic clinic, at least, and we can go beyond that to medical facilities of any type, should have to accommodate people with disabilities who can't transfer themselves or can't use the equipment in some way independently. And the EFW people wanted to make that my problem, and I wanted to make it their problem. And I think ultimately, when I looked at how they acted throughout the process of the human rights complaint, I think they also wanted to make it AHS's problem, like have a billing code that would pay them for their work of accommodating me. But luckily, that's not how it ended up. That is not how the results of the case went. So this is just like the headline of what happened when I had a positive decision in my go in my direction. And so I actually had to contact the newspapers, and I contacted different journalists, because it's not like a case at the Human Rights Tribunal here in Alberta suddenly gets its way into like the newspaper unless someone tells the newspaper to care about it. So I did that because I knew that otherwise no one will know that it happened, right? Because everyone's not just reading legal cases unless you're like in law school or you're a lawyer practicing in that area. So I wanted to publicize it, and that led to wonderful connections like ours. And so what I did was publicize it through the media, and then I also talked to people at the Alberta Medical Association, and I tried to contact the college. The college was not as helpful, but in any case, I'm still working on publicizing this. And so you can go to the next slide. So that's the basics of the story, but there's a few things I wanted to share with you so that you can both understand the human rights complaint process better and use it potentially, or help someone else use it, and or do research better about these issues. So the slide right now has a letter, and I heard there was a lot of physiatrists in the crowd, I thought. The first is a letter from my physiatrist, who was just essentially writing me a supporting letter. So this was one of my pieces of evidence in the case. This was amazing. This is an example of allyship, right? This didn't take much time for my doctor to do, and she basically said, this issue is not just Stephanie. Other patients, and she sees a lot of patients in wheelchairs, right? She pointed out bone density scans are also hard to get in Calgary for people like me, unless you have someone who can transfer you. I don't even know if the machine's accessible in any way. No, so I haven't had a bone density scan. Anyways, the second is my other piece of evidence, which was photos from Facebook from the Victoria Airport. So I thought that the best way to accommodate people like me in a clinic for diagnostics would be to have a mechanical patient lift. And so I was trying to show the tribunal, it's a one-member decision panel, so it was, we'll call it the panel member. It's not a judge, it's a less formal role. The person's not a judge. I wanted to show the panel member that it's commonplace to have these lifts and that it's even self-service in an airport, because the EFW's lawyer and their medical director, Dr. Lautner, was trying to say that, oh, this is so dangerous. Like a mechanical lift will be too dangerous for people to even use on their own if we just provide it in one of our clinics. So it's very, very patronizing. And he and I had a nice little back and forth when I got to cross-examine him myself at the hearing. It was really fun. So anyways, those were two pieces of evidence, and I showed other things. You can go to the last two slides if just quickly, just to preview this. So this is a good one to stick with. This is actually from the American with Disabilities Act website. So they have a website that tells people who have clinics or any type of like open to the public facility specifics on how to be accessible. And so the ADA, the Americans with Disabilities Act, is much more proactive in terms of giving clear guidance. So this diagram shows, this would be the proper way to have an accessible exam table in a doctor's office. So this is what I wanted. Go back one slide. And then this was really helpful. This is a document published by the ADA. And who knows, maybe this has all been burned to the ground by now in the US. But this was published when I brought my case in 2021. This was already up on their website during the Biden years. So the obvious question, you don't even have to read anything else, is no and no. You cannot tell a patient no just because you don't have the equipment, and you cannot tell a patient to bring someone who can help them as a prerequisite to the appointment. So that was perfect. I was like, oh, I'm proving my case. It's amazing. And look at this diagram from the next slide. That's so obvious, like what you need to have. And so I thought, this is a slam dunk. And unfortunately, it wasn't quite a slam dunk. So that first slide, you can go back to the first slide. I'm all jumping all over the place because I have help. Keep going back. And one more back. This kind of says that I'm the winner, even though I would say technically there was things I didn't win on. For example, I didn't win on the point that automatically what's under the ADA as like the best practice or the rules, that would somehow be the Canadian way. And I thought that was pretty shocking, because since when are we like a lower level of human rights than the US? But yeah, the panel member said in her decision, you can read it if you Google EFW and Chipeur, it'll come up on like free online legal database, Canly. So if you want to read the decision, if it's useful and applicable to you and you want to know more. Anyway, she said that the US stuff was just irrelevant to her. So that was pretty conservative view. And you'll know that we live in a conservative province. And that means that a lot of the people appointed at the Human Rights Commission are going to be more conservative in terms of their understanding of human rights. So that's just an unfortunate part of it. So she said no to that. And then she also said she wasn't going to require the clinic to have a lift, a patient lift. So now you can go forward to the one with the case name. Instead, she said that EFW's solution of hiring a private paramedic company to pick me up and put me onto a table is a reasonable accommodation. And that's the key in human rights cases, reasonableness. And so I thought that was not great, because what if I had an injury in my shoulder? And there's so many people, of course we're gonna have injuries in the spots where we get picked up, which is at our knees and our shoulders. So it seems ridiculous, but, and I even showed videos of myself getting picked up by those paramedics at EFW, because when I went for another ultrasound at EFW, I asked my friend to video it. And so we had the video, and then we had a video of me using the patient lift I have at home. And so it was really obvious how violative, you could say, the pickup was, because it was these men that I'd never met before, and it just, my body's just being treated like a piece of luggage. But anyways, so I would have, if I could have appealed this, I would have said, I would have appealed on the basis that any accommodation is not reasonable if it requires doing something that involves someone's body against their consent, right? But I decided not to appeal because I got a really large financial damages award for the fact that they had not accommodated me. So I got 15,000, which is the second largest award they've given in Alberta for a discrimination claim that involves publicly available services. And so anything to do with healthcare would be publicly available services. So I decided I better not appeal, because the judges in the regular courts that are not Human Rights Commission judges might be even more conservative, and I was worried they could like change the decision to go worse for me and worse for others, more importantly. So I did not appeal on that basis. But I think that there are lessons to be learned about the case. Even if I don't think it was a perfect win, it was still, I think, a good example of like how disabled people can take control of the agenda and to fight for what we know our needs are and to be treated equally. So we can go to the next one. So this is an article from a journal of medical imaging that I found, and it's written by a disabled person, and she talks about some of the hidden issues for people with disabilities in diagnostics. And so the thing that EFW wasn't considering is that not all disabled people have someone that comes with them everywhere and that can pick them up. Like, think about it. That is unreasonable. And if you see the people that are doing the unpaid care with lots of people with disabilities, it's going to be small women usually, right? Whether it's your family or a paid caregiver. I know for a fact, I don't need to see stats, that those are usually going to be women, right? And one woman caregiver that I bring with me is not going to be able to pick me up. So it's quite unreasonable that I should pay two large people that are strong to pick me up just to come to these appointments. And they were not thinking about the hidden costs of that. And so Lene Anderson in this article talks about paying out of pocket for the attendant that would come. And then also just the history of underserved disabled people in healthcare. And that was already mentioned previously today by Bonnie, that, you know, so often people are not getting the proper medical exams and tests because of laziness and ableism in your profession, to those of you going into the medical profession. And so I've had a mammogram for the first time this past year. And you know what? I went back to EFW because they are afraid of me now. And they gave me two of their top techs that have the most experience that came from my mammogram. And they got me in there, even though it was hard. And they knew that they were going to get a human rights complaint if anything went wrong. And so that was good. And you know what? I think that is what it takes sometimes, that they have to be a bit afraid of disabled folks in order to make any changes. They're not going to do it out of the kindness of their heart, as they made clear that it was about not getting paid enough by HS to do this work, and who's going to pay for this $11,000 lift. It's too much for these poor radiologist-owned diagnostic practice, who are the most well-paid doctors in our province, right? So part of why I think I got the 15,000, by the way, is because I was showing the salaries of radiologists. And when there's deep pockets like that, like when it's a university, when it's a doctor, sorry, but you guys are, if you're doctors, and even if you're working at the university, these are spaces where you're definitely considered like deep pockets. So you're not going to get like you're going to be expected to do the most accommodation up to the point of undue hardship. And if you're at a university, if you're at a medical professional clinic, that's going to be a pretty high bar, because you are probably the most privileged people in society, having great jobs and having the responsibility to make your medical services accessible, or your university space accessible. And of course, universities are deep pockets, and they also are both. All of these are connected to government pockets too, right? So it's the highest level of accommodation is going to be expected. So you can go to this. Yeah, go back to this slide. So what I want to say about this again, so I showed you that it's very obvious and clear for the Americans that want to know what their responsibilities are. But what's really terrible, even though I think the human rights complaint system can be used for disabled people to control the agenda of like what is going to be litigated and what issues are going to come before decision makers about discrimination. It's not a great system for people to understand what their obligations are. So I refused to settle in my case because I didn't want my case to be hidden and subject to an NDA. Because every single case that comes to the Human Rights Commission, they are all pressured to settle. And that's actually beneficial for people who need money and need it right away, especially people who are discriminated against in an employment context, right? You can see why someone might need access to damages award fast or a settlement fast. And so it can be beneficial to complainants to get money ASAP. But I did not care about that, obviously, because this wasn't about my employment. It was an issue that was farther away from like the core of my life. Like I don't see these EFW people all the time. So I didn't care about pushing to the end for a reported decision, because like I told you, you can now read this decision. So that's a huge problem, because all of those cases that get settled, we never know what happened, and therefore there's no precedent and there's no guidance. So I could have easily been not the first person to bring a case like this, and it could have been settled and no one would know. And that's not only a disservice to disabled people like myself to not know what our rights are, but it's a disservice to you guys who are in the medical profession, for those of you who are, or to anyone who is having a complaint brought against them, because you guys also don't know what your responsibilities are. And our Alberta Human Rights Commission is really annoying in the fact that they don't publish any proactive guidance like other provinces do. Like Ontario will publish proactive recommendations, but ours, we're just, unfortunately, it's a creature of appointments to this body by political actors. So we definitely have a more conservative skewed commission. And so I think that the fear that people might have who are practicing that you're going to have a complaint brought against you, I hope it won't make you as afraid as you might be for like a malpractice kind of case or negligence case, because you can actually help clarify the duties for others and for others like your peers, other medical professionals, and for the disability community, because the only reason we'll know in Canada that you're not allowed to force people to bring caregivers to transfer them, and you must accommodate them and pay for that accommodation, is because I brought my case. And the only other case that I was able to find nationwide was settled, and I only know about it because there was a procedural reported case where it was about removing one of the parties to the suit, and it was from BC. I contacted the woman in BC, and she told me that the settlement led to patient lifts being installed at the clinic she complained about, but she wasn't even allowed to tell me that, and I'm under no obligation because I didn't sign the NDA. So I'll tell you that that's what happened, but it's not helpful for anyone that that NDA happened. And the Human Rights Commission pushes the NDAs, but there's no legal requirement to do them. So you can see how the human rights complaint process and outcomes can be hidden and shadowy, and therefore not serving either those who could be at risk of having a complaint brought against them, or those who want to know, is it fair for them to ask me to pay my caregivers or bring unpaid caregivers to my appointment. So I think that I would hope that you could be less afraid of a human rights complaint if you see yourself as one day practicing or being involved, even as an educator at a university. You could potentially have issues to do with accommodations in this setting as well, and you might be responsible for that. So there could be moments when you might think, oh, a human rights complaint could be brought against me. Don't see it as such a bad thing. It's not like you're actually being sued. It's a moment to figure out what is our law in Canada on human rights. And I think it's also a chance for you to learn, because the process itself is a lot of settlement meetings, and it can go all the way to the end. And the EFW paid their lawyers a lot of money to fight me, and so I know that they must have paid over $15,000 in legal fees on top of the money they had to pay me. And I'm just like, how are you ever going to prove that you don't have deep pockets when you're paying like a fancy lawyer to go to the Human Rights Commission? So I would wish that, doctors and people involved in the health profession don't hire lawyers. Come as you are, just like complainants do. We don't have lawyers. This process is meant to be self-serve. We don't need, you're just hurting yourself by proving that you're more willing to pay a lawyer than do a simple accommodation. So I know that probably that's crazy advice coming from someone who's a lawyer. Don't hire a lawyer to defend you. But I think the lawyer that was involved in the case and was representing EFW really misled them and made them think they were going to be fine pushing all the way to the end. And I was surprised that they fought me so hard, and I didn't understand. And I think I really was a victim of them trying to pressure AHS to make up a new billing code. So I think they thought if we continue pushing back on patients and saying no to them, then one day AHS will say, oh, we're going to start paying you for accommodating these disabled folks. And that's just not fair. If you want to negotiate that, do it with AHS, but don't say and leave all these people without diagnostics who probably need it more than your average person, and don't like hurt people's healthcare just to squeeze a few more dollars out of AHS. And I have no sympathy for radiologists. Sorry, guys. They have the least experience with patients and they're paid the most. So I think that's like, those are the general points that I wanted to share with you. And I'd love it and I hope did I even reach the end? I wasn't paying attention. I actually would love to leave more time for questions because I actually want to know what you guys want to know, because I think I'm assuming based on that survey what you might need to know. But I would love to get some interaction and not continue talking at you, especially this late in the day after you've already sat through all of our talks.
Great job. Yes, there's a lot of hot interaction on Slido, so
Great.
Make sure you join the action and upvote. Okay, so you mentioned a few times the influence of politics. So in Alberta, someone has written the government seems to be going after people with disabilities. How do we combat this? They gave a few examples: letter writing, efforts to improve public knowledge or debunk misinformation, sign a petition, go to protest. Are these the only options? Should we be doing something more, something different? What do we do?
So for those who don't have a position of power as like an actual prescribing physician, because I have advice for those folks, but if you don't have that kind of power, I think certainly getting involved in politics by make sure you're voting is key. But I actually think that in this kind of a government, facts and voicing your opposition means nothing to them. So I think we kind of just have to do our own thing. So I think getting involved at the college, if you're in a regulated profession, would be wonderful, because they actually have a lot of power over the accreditation of places like EFW. Like if the college said, EFW, you can't be open without an accessible patient lift, then that would be great. That would fix everything for me. And so if you get involved at your association, your professional associations, or get involved in the university in any sort of accommodation committees that might exist in your department, and you are an ally to the disability community, you'll make a huge difference, I think. But for physicians and anyone who's writing, and it's not just physicians, it's other regulated health professionals who are writing any sort of report, the gatekeeper function you perform is so powerful. And if you only just try to, I don't know how you guys do it and how you do it with like so many patients, because I know you're probably constantly filling out reports. But if you just try to remember that the programs and services you're helping people get are so like below poverty line, that don't try to assess whether you think this is a person who's really needs it, because it's such a small amount and there's so many controls over how much you can earn to get disability benefits or any of these supports and services, that I would wish that you could just like leave your own assessment of whether this person deserves these disability programs or not, and just say, you know what, any patient who needs this, I'm gonna write a really great report for them. You would save them, because it's not like you're the decider anyways, like the government will still decide, but doctors have so much power. And I sit on the appeal panel for AISH appeals, which will soon not be in front of me, they'll be in front of doctors. So maybe you can join the medical appeal panel for the new disability program here in Alberta, because only people regulated under the Health Professionals Act can join that panel. And you can be a great ally there. But if you knew how poorly doctors are filling out these AISH applications and other kinds of applications, they're really hurting the patients because they're writing so terribly and you can't even read it barely. And they're not, it's like you are the difference between this person living in extreme poverty or like just less extreme poverty. And that's all. You're not like handing them a limo and like a penthouse. Like that's not, despite what the UCP wants to say, disability benefits are so low that you're just helping someone scrape by barely even paying their rent if you give them help to get on AISH or ADAP as it'll soon be.
Yeah, awesome. Thank you. So that leads into the next question, which we've talked about with a few other speakers, the relationship between disability and poverty and income.
Yeah.
Access to lawyers is very expensive. So how can we access support to launch legal cases like this when it's so costly?
Yeah, so that's a good point to make. So the human rights complaint process is very self-serve, and so you don't need a lawyer. And I know I was doing it as a lawyer, so that's unfair that I'm saying, oh, it's easy, guys. But let me tell you why it's easy. So there's a phone number you can call, and that phone number, they'll give you advice about whether they think you have a case. You don't have to listen to them, but at least they can give you some information because they sometimes think it's not a case. And by the way, one of my favorite cases from Nova Scotia, the Human Rights Commission completely rejected it, and they won by applying to the court to say, no, this is a human rights case, and they won. But that's a different situation. We're trying to talk about, doing this on your own. So you don't have to listen to the phone number, but it's free advice, so why not take it? Then if you fill out the form itself, it's very easy. And the whole process, you get a lawyer from the Human Rights Commission, not as your lawyer, but as your support. So if your case is considered to be a real one, like if it's not, sometimes you might be complaining about your neighbor who has no power over you. Well, that's not going to be a human rights case. It has to be someone offering services in public, who's your employer, someone or your landlord. It can't just be someone you met once that insulted you, right? So they'll tell you at the Human Rights Commission whether your case is justiciable, which means that it's a case that can be adjudicated because it involves what the human rights legislation deals with. It's a relationship where you're being discriminated against, and it's under the list of types of relationships. So anyways, you get that lawyer, and that lawyer will talk for you. You don't even have to speak like I did. You don't have to cross-examine. That lawyer from the Human Rights Commission will do all the work of the case. So that's really accessible in my view. And I think that you can be as involved or as not involved as you want to. And all you have to do is tell your story. So I think it's a very accessible, and I want more people to do it, because if we totally overload them with really great cases, I think it forces change potentially in a systemic way when there's a whole lot of cases about one issue. I think that can be there can be potentially a lot of power with that. And I think it's an underutilized service that's available, and I think people are intimidated by it, but I just encourage you not to be intimidated. And as a doctor, you can really help by simply writing a letter, or you can appear in person if you want to help your patient out even more. And telling and being a witness to discrimination and telling that story, you give such legitimacy to that patient. So I think it's a very accessible format, and I think the important thing is we have to use it because it's clearly accessibility legislation is never coming in the foreseeable future. So the only way to have any power with a government that hates disabled people, I think, is to go through the human rights complaint process potentially. So I would encourage you guys to get involved in that, or use it yourself if you have a good reason. And I want to say one thing is that it's really, really hard to prove racism, isn't it? These days, everyone just hides racism or sexism, usually. In Alberta, there's a lot more like transphobia and and homophobia than that's overt, I guess we could say. But disability discrimination is really easy to prove because people think they're not being discriminatory when they are. So if you're being discriminated on multiple grounds, the disability one might be the easiest one to prove. So at least you can do that. But I encourage you to bring up all the grounds under which you're discriminated against. But I just think it's really hard to prove those other ones, right? Because people don't say them out loud anymore these days as much.
Yeah, thank you so much. I guess, can you talk a bit more about how your case will impact other healthcare settings and clinics in Alberta moving forward? Someone has said, I still have patients who are routinely turned away for similar procedures and experiencing roadblocks in accessing care.
Okay, so definitely if you are that person that just asked that question, you can literally print my case off and send it to the place that's refusing and say, you're breaking the law. Because the case, that should never happen. Like, this should be, but it's not that this case changed anything, right? You have to have the knowledge of it to enforce it. It's not like suddenly everyone became aware that you're not allowed to say people have to be given appointments without requiring people to bring a caregiver or whatever the reason for refusal is. You just can't do it. And so I think if I was a doctor and I was doing a requisition these days, I don't know if this applies to the person who spoke, but if I was doing a requisition these days, what I would do is write, the patient requires full transfer as per Chipeur v. EFW 2025. Just cite that case, and they can send it to their legal department to figure out what you mean. Because you can say, like, you're not allowed to say no, and you must give this patient full transfer. And they can figure out, because the human rights decision maker said that they can have a private paramedic company, they'll figure out whether they're going to hire that or do what they want to do. But I think citing the case, you can make it real, because otherwise I can't, other than like telling people, right? And using it for my own benefits, which I already have many times, because I always need diagnostics. But yeah, that's the way doctors and anyone can use it. And use it, it doesn't have to be a specific issue of like this exact thing. You can use it for anything where your patient's getting rejected for a disability reason, because that's the way law works. It's about the most similar case, and so it doesn't have to be exactly the same fact scenario as mine. You could just use it, and you can use it anywhere in Canada because it'll be persuasive even if it's not technically binding, which I think is silly. In Canada, it should just apply everywhere, but yeah, I think that's the best way to do it as a practitioner.
Yeah, I was just going to echo that. We made similar wording and circulated it to all the Canadian physiatrists. So if anyone wants that, I'm happy to send it to you if you just email me or email our lab. Okay, other than suing, what is the best approach to push leaders to make our environments more accessible?
I think you have to like hire people that are disabled, because once people work and know people, then they change, it seems. So I feel that and so then that goes to employment discrimination and the questions we were talking about earlier today, like how do you make sure that people are not discriminated against when they disclose, right? So, but I honestly feel like that's true with any group that's left out and not in positions of power. As soon as you're forced to work with someone, you suddenly realize that you can't say the things you used to say in front of everyone. Like when it's such a homogenous group, as universities have been, as the profession of medicine and the legal profession have been so homogenous, as more people have got positions of power, that's the only way I think things change. I don't think things change from the kindness of people's hearts. I think it's like you realize that either there's legal consequences or just the awkwardness of like being incredibly rude to your colleague, that you're not including them, etc. So I think advocating for more diversity in the university or in medical school, like one of the wonderful poster presentations, Sarah Dabrowski, right? Am I saying you're Dabrowski? Did a poster about how to get more disabled medical students. And I think that that's the only way. You need more disabled doctors so that doctors are more understanding in general of the experience of disability, rather than just trying to get by and not wanting, like, I do think doctors aren't trying to like hurt the disability community, but I think somehow doctors have been foisted this responsibility of being the gatekeepers for everything with the assessments you do and the reports you provide, that are the evidence of someone's disability. So I think if that's going to be the way we do it, and I don't see it changing, like I don't see the government suddenly saying, oh, everyone can just self-identify as disabled and then get everything that disabled people get under the programs. So I think until that, I think you just need more disabled doctors probably.
Great point. And probably we mentioned there's a lot of researchers and academics, so maybe even in those spheres as well.
Oh yeah, absolutely. Because more disabled researchers means that people who've normally been left out of studies are going to get included, and you're going to have different ways of thinking about approaches to problems, and asking questions of populations that were never asked before because they were just completely invisible to maybe the people in those academic positions, the researcher positions.
Totally. Okay, so how can we support changing the way the Human Rights Commission in Alberta is run? Questions around who gets to be on the commission, changing pressure to sign non-disclosure agreements. How can we pressure them to make more proactive recommendations? What are your thoughts on that?
So I really wish that would happen. Right now, I think maybe just having more people use the system. I think it was really overwhelmed by people who were using human rights cases to be anti-mask or anti-COVID restrictions. So that really bogged down. And that seemed to be a little bit of a distortion of the purpose of the Human Rights Commission. Like even Danielle Smith said, like the people who are unvaccinated are the most discriminated against group ever. Like it's just ridiculous. So I think if more disabled folks and allies, including doctors, would just use the process and inundate with the issues that we care about, I think that's the only way to control it, because these folks are appointed by the government of the day, and I think they stick around for years. So I think, you know, some of them are going to be from previous administrations that are different than today's, but my view is like just inundate with more cases, and I think that's like if they have a ton of cases, I just don't see how they can't at least proactively publish something, or, you know, push the case all the way to the end, don't settle, and go for a full reported case so that it will be public as opposed to secretive. And also, if you want to settle, refuse to do the NDAs because you don't have to. I don't know. That would be my best case scenario, because I don't think, other than electing an NDP government, there's no other way to get a more disability like a disability perspective into places of power.
Yeah, thank you. A few people have asked about how do we become our own advocate? What's the first step we could take?
I think just be open to the idea that you should just act a bit more entitled, because I think so many people are just not wanting to assert themselves. And so I think if you are someone with a disability, or you are, you know, someone who's experienced microaggressions and lots of discrimination in your life, you might be angry about it, but also just not want to act like the very people that are oppressing you who are so entitled. But I think maybe you need to be a bit more entitled and outraged about the small things. So I think it's good when people just realize that it's better to act like you deserve things than try to get things by being like, oh, I'm sorry to even ask. Like, I really need to also use the washroom here. Is that okay? Like, that's not appropriate that you're being put in that position to ask for it. But I think if everyone would just be a little bit more entitled who is disabled, then people who are able-bodied who don't understand, they'll feel awkward that they like tried to put you in a position where you didn't have the same comfort as everyone else. And so, I mean, cheers to you guys who organized the conference, because I haven't felt that way here. So it's awesome. But it's, yeah, I think just be a little less sorry for asking for stuff is the only thing I can think of. Because I was a total brat with EFW, because I knew it was going to be hilarious to make their legal fees go up, up, up when they refused to buy like a cheap lift. And so I just acted super entitled about it, and it paid off.
Awesome, thanks. I guess on a related line, this is a healthcare provider, and they're kind of asking, like, who is the onus on? Should it be with the person confirming an appointment to ask about accessibility needs, or on the person who has a disability to kind of mention it?
Yeah, so the the way that EFW had it was that they knew, because my doctor put on the requisition that I needed help. So they knew, and I think that's probably going to be the case. Most doctors would put, if you have someone who needs assistance, it's going to be on that sheet. So let's say, for example, you're calling a place that doesn't see your requisition yet because it hasn't been sent in, then you're going to have to disclose. I think that the onus should be on the person doing appointment. Like, I think proper training would be that they would say, like, do you require any accommodations at your appointment? Like, how can we help you? And then the training will be that they actually have a plan for every person. And the plan isn't just to say, go to the hospital. Because part of why my case was successful is that I couldn't go to the hospital because musculoskeletal MSK, I can't say the word, MSK ultrasounds are only done at the private clinics. They're not done at the hospital. Like, I couldn't get it done there, so that's why. So anyways, I think the best practice is that they have made a plan. Like, that is the obligation. That's universal design, is that you as a provider have made those plans. And so, yeah, you should ask. And again, I don't think, don't be shy to say the word disability. Like, I think sometimes people think they'll offend, but I think it's just clear language when we're talking about disability to just say, do you have any disabilities that or do you require accommodation? Like, those are normal things to ask.
Awesome. Thank you. That's probably all the time we have. So really appreciate you coming and sharing your story.
Thanks, guys.